All right, Anne and I are going to present together. I'm Cheryl Armstrong, an associate professor in the College of Nursing.
And I'm Ann Beth, also an associate professor in the College of Nursing and the director of the Simulation Center. And this is Grace. Can't hear me? Sorry, I will speak up.
Did it turn off?
So we know that all of our programs are really stressful. Maybe nursing, especially because it's so short and concentrated. There's a lot of stress, and we also know that our students bring a lot of, and our faculty and our staff bring mental health challenges to the programs with them. So this project stemmed, we had talked for several months about instituting a faculty student mentoring program. Unfortunately, in March of 2019, one of our students died by suicide, and this became it was obviously quite heartbreaking and woke us up even more. So this we instituted this program of benching faculty with students so that they had one more one more support system. There's no requirements of them or whatever. It was just one more person to have a connection with. So we know that increased levels of stress and help make our students vulnerable. We instituted this program to, as I said, sort of give one more part of the safety net, maybe helping with stress, promoting wellness, and also in increasing retention rates. So yeah, I think that's
okay. So as Anne mentioned, we pair faculty with students. We start them in the beginning of their program, and the same faculty follows them throughout their program, whether they're full or part-time students, which has been very helpful. We're not experts. I've been one of the faculty since it started, and we're not experts. We just kind of know resources. So a lot of students will ask questions, and we just kind of guide them for where to go with questions. So we did want to take a look. We had a lot of anecdotal evidence, and we really wanted to do a survey, and eventually we're going to do some focus groups. But we want to see, is this really as successful and as beneficial as we feel like it is? So we would get a lot of good feedback from students. So we created an online mixed method survey, went through the IRB process, and then we got some data and did a SWOT analysis. So we had really good participation, 140 students participated. It was great to see that 70% knew who their mentor was. That was good to see. We were a little bit like, how do they all not know? But they get busy. At least 30% had attended scheduled meetings, and that's something we're looking at, improving attendance at those. It's all totally voluntary. We're trying to coordinate it when the students have class, like right after, things like that. So we did find students were very likely or somewhat likely to reach out, and that they found the program either somewhat to extremely valuable. So we got some good feedback. We did note a lot of strengths. So heightened sense of belonging, great interactions with faculty, mentors, and some weaknesses or things we could improve upon, including getting mentors to be involved consistently, and also making sure students know about the program and its benefits. So conclusions are programs can be designed successfully, similar to this, to offer support to any student, including nursing students. And recommendations, we're going to survey faculty next. We're going to do some focus groups, and then just make some changes to the program. We think it's a great program and it's been beneficial, so we just want to keep it going. And thanks to Anne for really being the one who started all of it.